So I'd like to welcome all of you formally to the Stockbridge Library, Museum and Archives Narrative Medicine series. This series is hosted by Dr. Owen Lewis, who is, I'm going to say, an expert on narrative medicine as both a physician and a poet. And Dr. Lewis, I hope you'll explain to us a little bit about narrative medicine. And this evening we will be delving into the difficult topic of cancer. And we're very lucky to have with us this evening Wendy French, who is a poet and she's also a professional tutor in the field of health. And she is working currently with adults suffering from aphasia and dysphagia. And her recent projects focused on children with mental health problems and learning difficulties. So we are happy to have Wendy with us this evening. Her book, which we have at the Stockbridge Library, Thinks Itself a Hawk, is what we'll be exploring this evening. So without further ado, I turn the program over to you, Owen, and you, Wendy. Thank you both for joining us.
Thank you. Thank you.
Wendy, thank you so much for joining us and staying up late. You know, it's a little later in London than it is for us. So this is really the end of the night for you. A few other things I'd like to say about Wendy. She has been involved in the narrative medicine movement for a very long time. And the book she's going to read from grows out of work she did in a cancer hospital with sufferers of cancer. And that work really, and her experiences really infused this book. I actually met Wendy in London in 2016. I was fortunate to have been selected as the winner of the Hippocrates Prize for Poetry and Medicine, which is quite an important contest in this area. And Wendy was one of the judges. And well, we became friends right off, and we've been corresponding and helping with one another's work ever since then. I just want to, before we get on to her book, She Thinks Herself a Hawk, here is Wendy's latest book, Bread Without Butter, Bara Hebfanin. Do I pronounce it right?
Yeah, that's fine.
That's
Bara Hebfanin, yes.
Which is a book that really talks about growing up in England with a very strong cultural background to Wales. And we presented earlier this year in a panel on poetries of the diaspora. And this was really quite interesting to see the commonalities of diaspora across, or diasporic people and their poetries and experiences across cultures. And so this is really quite a beautiful book. But we're not talking about that tonight. We're talking about Thinks Itself a Hawk. Wendy, would you tell us a little bit about the project that you were involved with that preceded the writing of this book?
Yes, certainly. Thank you, Owen. It feels quite formal with just such a select group here, and I'd written some notes out, which I will just refer to because I tend to go off at a tangent when I start speaking. Thank you, Wendy, and thank you, Owen, for inviting me tonight to talk about something that's very dear to my heart, which is narrative medicine, because everybody's a story. We're all made up of stories. If we saw the same accident in the road, we would put a slightly different twist to it when we're telling that story to someone else, depending what's going on for us in our lives or what we've seen or heard before. And so I say to all the people I work with, you are a unique story. And that's the premise that I work from, really. Everybody's unique, everybody's a story, and everybody has something to say. Before I took on the work at Macmillan, I was head of a very small school in a psychiatric hospital. So it's really nice to have you here tonight, Virginia. And I ran a very arts-based curriculum in this school. I'm not a psychiatrist, but I worked right on the edge of psychiatry with psychiatrists. And through the arts, children came into our school each day to try and keep normality in their lives. And we kept art, poetry, music, drama going to under the sort of national curriculum guidelines that are set out in the country, so that children believed that we believed in them to keep their schoolwork going, but also the arts helped them to process things that were going on in their mind. I was head of this school for a very long time, and I left early because one day I thought, I can't take other people's sadness anymore. That's the sadness of the parents who felt they'd lost a child through schizophrenia or some other, or anorexia, or some other really debilitating condition. And so I left that job, and then I thought, I can't sit at home and do nothing. So I saw a job advertised at Macmillan Cancer Centre, which is part of University College Hospital in London, and I applied for it, but I applied for the wrong job. And it was for a creative artist rather than a writer. But I sent my CV in, applied for the job, and they said, oh, that wasn't what we wanted, but come and see us because your CV is very interesting. So I went to see them, and I landed myself as first a volunteer and then poet in residence, where I actually got paid work for running groups for patients and carers, all connected in some way or other with cancer. And I also now have just started work at Maggie's. Maggie's centres are set up all over the UK, and there are other centres that deal with people with cancer, providing different activities for them to take their mind off their illness and to work and be with other like-minded people. Both centres offer an amazing opportunity for patients and carers. With all my work with Macmillan, with Maggie's, and indeed with young people with psychiatric problems, I used the Hippocrates premise in my mind, which was cure sometimes, treat often, comfort always. So I come in from the comfort always, and treating only with the help of psychiatrists who guide us through what work that we have to do to devise a curriculum that fits in with the medical work that's going on, because I'm not a medic, but to enhance the experience that patients are getting. And so I think that my task really is to give hope and to listen, because these patients need to be listened to. And I'm calling them patients now. Sometimes they're called clients, sometimes they're called managers, they're called all sorts of, because they're managing their condition, all sorts of different things. But for me at the moment, they're patients, which I don't like to use because I keep telling them how unique they are, and then I'm referring to them as a patient. So I'm being a bit hypothetical there. Anyway, Macmillan Cancer Centre has a huge living room. As you go into the centre, it's opposite the hospital. It's a very light, airy building with a very big, magnificent art display in the centre. And to the right is the room called the living room, which I think is rather an unfortunate term for the room, really. And it's a room where anybody can go to make tea, coffee, with an appointment, without an appointment, if they need to speak to a nurse specialist, or just to sit quietly in between appointments or to think. Now there's a big table, a big oak table that seats about 14 people. And that's where I run my group from this table at the end of the sort of working day. And people come in and sit down and we chat and they have a cup of tea, and I stick to times very strictly. So we start at 4:30, and I always give a sentence to start the group. I say to clear people's minds, or to write down whatever may be going on for them at that time that they want to clear out of their minds or think a little bit more about. And they write for 5 minutes, and then we go around and we read what they've written. They don't have to read out their work, but most people do. And I give a sentence like, I laid my dream upon the pillow, something that they can use as fact or fantasy, magical, right for a child, right for an adult. But most people want to write from some aspects of their life, maybe that's gone on from them in the past, maybe that they're hoping for, or maybe something that's going on for now. In the whole time that I've been there, there have only been 2 people who have not been able in any way to address their present situation. That's fine, that's up to them. The group is not a therapy group insofar as it's to come and talk about their illness or how they're feeling, but a lot of people use it for that, and that is fine too. So they write their sentence, and then we discuss the work, we go round, and this is where my work comes in, I think. I have to listen to pick up the nuances that they might be wanting somebody to pick up on, but they can't actually express themselves by saying. So this is where listening comes in very important. It is very important. And I would like to just hear, I would like to read a poem by Raymond Carver, the very well-known American poet and short story writer, who wrote this poem about when he had cancer and had to go to see the doctor. And I read this to my groups often, and we laugh about it and we talk about it. And I also use this poem when I'm working with medical students about how important it is to listen to patients. I think this is a very good poem. You probably all know it, what the doctor said. He said, it doesn't look good. He said, it looks bad. In fact, real bad. He said, I counted 32 of them on one lung before I quit counting. Then I said, I'm glad. I wouldn't want to know it about any more being there. And he said, are you a religious man? Do you kneel down in forest groves and let yourself ask for help when you come to a waterfall, mist blowing against your face and arms? Do you stop and ask for understanding at these moments? I said, not yet, but I intend to start today. He said, I'm real sorry. He said, I wish I had some good news to give you. I said, Amen. And he said something else I didn't catch. And not knowing what else to do, and not wanting him to have to repeat it and me to have to fully digest it, I just looked at him for a minute, and he looked back. It was then I jumped up and thanked him and shook hands with this man who had just given me something no one else on earth had ever given me. I even thanked him again, habit being so strong. I really like that poem because the doctor is talking the whole time. The patient isn't having time to digest the news about what the doctor is saying. And the doctor is obviously very uncomfortable about having to give bad news to the patient. And I talk about this with my patients, and when they talk about their experiences with doctors who, on the whole, are fantastic and really good at listening to them. And so I read that poem because I think it's a good example of a doctor telling a patient exactly what's going on and not giving the patient time to digest it, to think about it, because of the doctor's feeling maybe of incompetence, which is what we often all feel when we're dealing with illness. So I use other people's poetry a lot when working with this group. And I work also with them from the premise that it's our imagination that keeps us alive. Without imagination, we might as well not be here. And I was listening to a program on the radio not long ago called Pain and Creativity. And two women were talking, and one said that she had great difficulty in getting up every morning because her pain was so bad. And then she joined a writing group, and she started to read poetry, which she hadn't read before. And the reading and the writing of poems gave her a reason to get up in the morning and to be thankful for the day, that she had something to do that took her mind off the pain. And she likened it to having morphine. She said the pain is still there, but when you're reading a good poem that speaks to you, or you're writing a poem, then that pain goes into another realm in your body. And there's a woman in my group who's got a neck and throat cancer and can't eat or drink except with a peg. And she said she feels exactly the same. Every morning she wakes up, she reads the same poem, which makes her get up and want to get on with the day. The poem she reads is Keats' Ode to Autumn, because it starts, "Where are the songs of spring? Ay, where are they? Think not of them, thou hast thou music too." So she's trying to tell herself that although her youth and her ability to do things has gone, she has still got something in her that she can give to others. And I think that's why this group is quite important to these patients. They really look forward to coming, to sharing their time together, to hear poems, to talk about poems, and to write poems. I also remind them of the words of Henry Van Dyke, who said, "Use what talents you possess. The woods would be very silent if no birds sang, except those that sang the best." So once we've done our 5-minute reading round and talked about what's going on for someone may be coming up for some aggressive treatment, someone may have just had an all clear and be very happy. We discuss all of these things so that people can show their sorrow, show their gladness with one another. And the feeling of the group is that we're all there together. Cancer is binding us, but poetry and the writing of it are the important things for the 2 hours that we are there. So each session I take a different theme to explore, and then we read poems round this theme. I might take journeys, I might take the sea, colours, places we love, and then we discuss the poems, I give some prompts, and people write about their whatever they want to write. I'm going to read a poem now by somebody called Zipporah, who was a Jewish woman in the group, lovely, lovely woman, who had a very aggressive cancer. And after we wrote about places we love, she wrote this place about Israel, about where she'd been born, but she'd actually traveled all over the world. Her mother died at her birth. So Zipporah, all through her life, carried guilt that her mother died because she was giving birth to Zipporah, and also anger with her mother because her mother left her, and to fend for herself in the world. So these were the two feelings she carried with her. And this was the poem she wrote. I came from palm trees and eucalyptus, hot sun, potatoes and oranges. I came from white sands, blue seas. I came from hot evenings and mosquitoes. I came from bonfires on the beach and night swimming, guitars and singing and watching the flames. I came from demonstrations and debates and fighting for the right. I came from falafel and hummus and olive trees. I came from all these, and then I flew away, looking for greener pastures that were not green when I got close. I came from another world, and one day I will go back. Unfortunately, she died. I'll speak a bit more about her later, but she died soon after writing that. And that last line means so much to me now. I came from another world, and one day I will go back. So I hope she's gone back there. She was a wonderful woman. And that was from the poem I took of, actually, it was Eden Rock by Charles Causley. I don't know if you know that poem, but it's one of my favorite. I just love it. And it's about a picnic that he had with his parents. And he goes back in time. And the specific detail in there is tremendous. And the group love it because of the detail in the poem. So she wrote that. And she was so pleased because she sent it to her family who are still in Israel. She sent it to her daughters who are all over the world. And she was owning again the place that she left as soon as she could, but only because of her mother's death, really. And she never settled without her mother there. A lot of friendships are formed in the group, which is wonderful. But again, I've been there about 8 years now, and we have seen people die, young people, middle-aged people, old people. So friendships have to be acknowledged, and then they're lost. And we have to work through all of that within the group as well. That's one of the hardest things to do. There was a girl in the group who got better, I'm very pleased to say. And she said, one day she came in and she said, I want to write about my cancer. I am so angry with it, but it's not going to get me. I'm going to tell it to go away. And this is what she wrote. It's called To Cancer, I'll Tell You. So you think you can get me? I'll tell you, you won't. So you think you can beat me? I tell you, you won't. So you think you can win? I'll tell you, you'll lose. So you think I won't fight? I'll tell you, I will. So you think that I'm weak? I'll tell you, I'm strong. So you can think what you like, and I'll tell you, you're wrong. So you think I didn't care when I didn't know you were there. So you think you can kill me. I'll tell you, you won't dare. So she felt much better after writing that. I'm not saying that saved her. Of course it didn't. The doctors saved her, but that helped her to feel better about herself. And that's all I can do. I'm not a medic. All I can do is try to help people feel better about themselves. There was another lovely man in the group called Graham. Unfortunately, he was in his late 30s. He had a double brain tumor, and he left a lovely wife and 2 little children, aged 6 and 4. But after he died, his wife came back and said, I just want to thank everybody in the group, because they gave Graham such a friendship during the last few months of his life. And he came to the group right to the end, even though he couldn't speak, he could barely write. And he wrote poems that his wife has had transcribed and made into books for his daughters. So they have got a part of his life they will always have with him. And he wrote a few poems, and this is one I really liked. He wrote it to his father, called Sailor's Button, because his father had been a sailor. The button is my father's when he sailed on a boat. He used to wear it on his sailor's coat, standing there in his blue uniform, brill-creamed hair all slick and shorn. The button sits there neat and set, gleaming on his epaulette, smiling, happy when he was 17, button gleaming from the oceans he'd been, sailing towards Egypt and Malta, button dress code, never to falter, My dad now looks down from a starry sky. I hope button code will still apply. I thought that was a very moving poem written by Graham, which now his daughters have got. And the last poem I'm just going to read you from one that a patient wrote. It's a young man in the group who's got a very unusual cancer, and he has to have a blood transfusion every 2 weeks. So it's very difficult for him to hold down a job because of, well, not hold down a job, he can hold a job, but he has to keep taking half a day off to go to the hospital. And employers aren't always so sympathetic with that. And also now he's very shaky. But he wrote this, he's got a great sense of humour. So content am I lying here, the sea crashing onto the rocks, the sky reflecting the blue of the sea, or vice versa, I don't know. So content am I lying here, the gulls overhead, lambs bleating, the cooking smells of the seaside special, chips, good and salty. So content am I lying here, away from the city of humans, people rushing everywhere, whatever the reason. So content am I lying here, until the beeping startles me. I look up and see the blood that is red. So he said when he's lying down having his blood, he always tries to think that he's at the sea somewhere and imagines the chips, salty, and the sea, and then the beeping wakes him up and he remembers where he is. But he said, writing that poem, he can chuckle about it now when he has to go yet again for another blood transfusion. If anybody wants to stop me and say anything, please do. Then I ran this general writing group, and then some people came to me and said, could we have a memoir group? We'd like to write more about our memories. And I went to talk to the cancer nurse specialist, and I said I'd be very happy to do this, but away from the general writing group, because not everybody wants to write a memoir group. Memory is very difficult. It's very difficult for all of us sometimes looking back, because not everybody has something in their life that may be hard to face for whatever different reasons. And if you're carrying a huge disease or tumor like cancer, that's painful enough without maybe delving back into other memories. But some people wanted to. So we said there'd be two groups running, the general writing group, where people could take any theme that I took in any direction, and a memoir group, which would tackle memory and memories. And people were advised to talk to the cancer nurse specialist first before joining this group, because I knew there'd be a couple of people that love writing but would find it very, very difficult. And that's just what we didn't want to distress anyone any more than they need to be. So the people who came, there were about 6 people. There were about 14 in the general writing group, and about 6 people came to the memoir group. And we explained it was not for everyone. Memoir can be painful when we're well, but carrying an illness too, it can be very hard. So the prompts that I took were similar but different prompts from the general group, but they were to focus back on something in the person's life that sparked off a memory or something that had happened to them in the way back in the past or the recent past. And we had 5 sessions which worked really well. And the memoir became the patient's almost transitional object, like a child has a transitional object of maybe a teddy bear or piece of sheet. The memoir became the transitional object almost of the writer, because it was their life, they were holding on to what had gone before, and it was helping them to look at another way of life coming to an end at some stage or other. They developed a new sense of self through this memoir, which was extraordinary. It was not what I'd expected to happen at all. It became very powerful for them. It was partly, I think, too, with the memoir. We wrote a lot of prose, and then we edited. And I think in the editing, they were sorting out things in their mind that they hadn't sorted out before in life. And literature and poetry can remind us of emotions that we've pushed away. It's part of human experience to feel pain. And at the end of life, I think it can be part of our experience to try and turn the emotional pain around, to reframe part of our lives so that we feel less negative about it. And that's what we tried to do. Some of the memories were very painful, but we kind of rephrased, we thought about them in different ways so that we're not taking away what actually happened, but by reframing the story, it helped the people to come more to terms with life as their lives were ending. So I see my work really, as I said at the beginning, as listening and helping and reframing and trying to feel more positive about what is going on for any one person. The American poet, I keep quoting American poets, I love American poets, Stanley Kuntz said, "Our body is a canvas that absorbs the world." And that's true of everybody. We're all absorbing all the time, things we see, we hear, things that are going on for us.
Wendy,
Yes,
may I
sure.
ask you this? With all that you've absorbed, both at the school and conducting these groups, I'd imagine writing, or the pressure of all that you absorb builds up, and the writing, your own writing must be a way to process this. How did you begin to write Thinks Itself a Hawk? And tell us a little bit about the entree, because, you know, sometimes using our patients' words, experiences, can be difficult. And so I wonder if you could talk about that and then read us a little bit from Thinks Itself a Hawk.
Sure. Yeah, it is difficult writing about other people's experiences. And I did write quite a bit about the children I worked with as well. And not from a sort of voyeur point of view, but my feeling is that if we don't write about things that are going on for other people, how will we all understand experiences that we would otherwise not have? That's why I read novels. I like to read novels to find out about other people's lives, which helps me in turn to understand what may be going on for someone else. So I know someone who's worked in a prison, and she said she would never write about any of the work that she does there because she thinks she would be being disloyal to the prisoners. But I said to her, well, you're not using their names. You can mix up stories. How will the rest of us ever understand what has driven some people into dire situations if we can't read about them and understand them from a writer's point of view? So I think I started to write this book because I needed to process for myself what was going on for some of these people. I took it home? Where do you put what you carry? You put it onto paper. I think by putting something onto paper, you remove a little bit of the pain from your own head onto the paper. So I started to write about the centre. I wrote a little bit about what I thought cancer was, I thought about cancer as a person trying to destroy us all. I thought about cancer in lots of different ways. I thought about it as a hawk attacking its unsuspecting prey. I thought about it as the cancer, as the crab, which is the cancer sign. And so I started to write all these things down, and it did help me to feel better. So the first poem in the book is called Cancer's Daily Walk. Cancer will walk in the country, in fields where Frisians wait to be milked. Cancer will walk in the town, in the city, enter St. Paul's when doors are open. Will walk through cafes, restaurants, when people order Americanos. Cancer will walk where its feet take it, into distracted bodies whose cells are greedy for change. And I suppose with the narrative medicine and the narrative medicine idea, again, when I was working at the hospital and particularly with young people, young girls with anorexia, we used to use a sort of narrative medicine approach to them. Why are you going to let this thing, this person, anorexia, take over your life? You're stronger than that. You can go away and choose your own friends. That was a sort of tactic. That's putting it very simply at the moment. But I think that was what I thought of with writing this book. Why should cancer take over people's lives? Let's try and think about it in another way. I spent a lot of time in the lobby, in the hall, just talking to people and observing people. And this is a story that one woman, one carer told me. She was just talking to me and I asked her if I could write down what she'd said and she said yes. And this is called Waiting in the Lobby. She had her dad in a wheelchair waiting to take him home. My dad's asleep. Once he wanted his story told, but now he sleeps, hat cocked to one side. Outside it rains and I've got to get him home. Volunteers wait to show people where to go. Touch screens the first time, not always easy. People fumble with the words, gender, address, date of birth. The television displays your name. We don't mind no privacy. Privacy's low down on the agenda here. Anything goes. I'll tell you what I don't like. The way that woman's picked up her paperback, bent the corner as if it had no feeling, no backbone. We say things we never thought we'd have to say. I like watching the volunteers. They clutch their clipboards, reassuringly, I suppose, as they guide us to lifts, the basement. Appointments are running late. We're all on the edge today, but doctors need time to listen, run tests. We all know, really. I like watching movement, faces, signs. Everyone wants to be a winner, but there's coffee and Richard in the coffee bar mixes another cappuccino and welcomes everyone, treats us like babes in the wood, looking for a way home. That man over there greeting his lover, that carer attentive to every move. Ambulance drivers stride in, cheerful, pick up their patients. The lobby speaks of the everyday, the next number, the blood tests, the rain, the shaking of umbrellas, the sucking of fruit gums, cheers, laughter, name recognition, the pulse of now. And my old dad still sleeps through the rain. I've got to get him home. So the lobby is where life happens. It's where everybody is. Owen, have I answered your question or not really?
Yes, but I'd like to hear more of these. Will you continue?
I'll read a couple more, but you're probably fed up with my voice by now.
No.
One day I was sitting in the living room around the table, and there was a young girl on my right, beautiful young girl of color, and we're a very mixed group, which is wonderful. And when we were just about to start, she got up to leave, and I said to her, "Oh, don't leave, please, you're very welcome to stay." And she said, "I can't stay, my consultant's calling me." And I said, oh, she said, I've got sickle cell disease, because sickle cell disease is also looked after at the Macmillan Cancer Centre. And I said, well, you know, do come back another time. And she said, yes, I'd love to. And she said to me, what's your name? So I told her my name, and she burst into tears. And I sort of held her and said, whatever's the matter? And she said, you used to be my head teacher 30 years ago. And I remembered her then, because I remembered her mother was often up at the school because of her sickle cell disease. But I mean, I hadn't recognized her because she was grown into a beautiful young lady from a little 6-year-old that she'd been when I taught her originally. And this is what it is. Here she was, someone I knew at the age of 6, and here 30 years later, she's sitting beside me in the Macmillan Cancer Centre, and it was such a coincidence. And so she did come back to the group a couple of times, but I wrote this poem about her, and it's called This Girl. This girl has a brother called Ash. He has dark curly hair. This beautiful girl has a lover. He may be beautiful. The girl's body does not behave. Her cells are sickle-shaped, like the sickle that cuts down the hay. She needs perfection in cells. What the girl needs, she dreams. She grows through life with clogging cells, blood exchanged like currency. Even now, the girl is beautiful. She mulls over words, breaks a muffin to enjoy. She tells me that pain is unpredictable, but there's refuge in books and music. Her eyes are brown, dark like a deep sea fish. Her breath, the presence and absence of. I have to walk up Tottenham Court Road to get to the centre, which is always a very, very busy road. And I was walking up there one day, and I was just thinking about all the new words that had entered my vocabulary since working at the centre. And this is called Tottenham Court Road. To UCH, where the flower market's lost to the traffic, and on the island in the middle of the road, people wait, lights change, and on the corner, a stranger sings something about someone who'll buy a beautiful morning. And all the unknowns circulate as the new vocabulary of others drowns common sense. Dialysis, stem cell transfusion. How many years will the same people cross the road here, and how many with all their words will lead others to shore? I worked for some time with the adolescents too, and that's quite different. The adolescents I found very painful often, because some of them were in wheelchairs, would never walk. Some of them had very poor life expectancy. Some would get better, some would be fine. But I loved it on the wig day, because the wig makers would come up, and the adolescent girls would immediately throw browns, blacks, fair away. They wanted the orange and the blue and the adolescent tattoos on them and everything, which was wonderful, because they had that spark for living still. And this is called Wig Day. Blues, pinks and purples all appear on level 3. No one is recognizable anymore. The professional wig makers arrive with sensible colors. Teenagers are more comfortable in orange than brown. It's the emerald and ruby that get us through, not jewels. And the other thing I liked too, I loved it when I would see the adolescents painting their nails or doing things that adolescent girls and boys do, because So there was that spark of hope in them, which is just wonderful to see. And this is called Revlon. Every down movement, a kind of seduction, each cuticle pushed back to reveal more nail. Her nails are as strong as they can be. No scrubbing pans, weeding the garden, planting potatoes. No need to watch the clock or think of others, now her ward round's over. For this is not the red of fire that sets alight the furnace. It's not the red that burns in passions at the end of day, nor the sunset's reflection on the hospital bed. It's the red of Revlon, painted against the hunger of white cells. I think I'll leave it there, Owen. I think everyone's heard enough of my voice now.
Could I just make a request? Maybe conclude with "We are made from stars." Just...
Yeah, there was there was I'm just trying to find it.
44.
Thank you very much. There was a sculptor in the center, made the most beautiful sculptures, and he made this huge star. I don't know, about I think this wide and about the same height, out of this gorgeous metal. And he presented it to the center, and it took all these men on a very hot day, wheeling it on a huge trolley down. And this star sits there. And I thought, yeah, we're made of stars. And I wrote this poem after he gave the center this star. He said, these were his words, "It was important to me to find a piece of stone which had been shaped and formed as much as possible by nature, offering different interpretations of scale, both size and time, in recognition of a sort of huge universal time scale." It's lovely. We are made from stars. This morning, I knew we came from stars, as through the labyrinth of corridors, a star has been delivered by men in shorts who push, wheel, and struggle with this limestone rock, gold metal dust with fragile bandages pulled away. In the deepest basement of the center, this is ours to keep. Not shining brightly from the universe, it rests, its final destination. A child may be so desolate, not look up, but if she does, she'll catch a star. Within her gaze, a star is hers to keep. It glows and shines without intention. Like loneliness, this star has found a place. Thank you, Owen. Thank you. Thank you, everybody, for listening.
Well, thank you, Wendy, for reading for us and sharing all of your stories. Very moving and just really good work that you do.
Yeah, I'd like to thank Wendy also and for reminding us how porous poetry is. I mean, you cover such a wide range of imagery and experience, and what else but poetry would allow that? And thank you for quoting some of my favorite poets. And I wonder if you've read any Frank O'Hara, because
yes,
when you were walking down Tottenham Road, I was thinking of Frank O'Hara's poem, A Step Away from Them, and you know, something as mundane as a lunch break, and then sort of the, you know, all life in the afterlife is kind of blowing through him. And
I know. I love the day Lady died. Is it the day Lady died?
yes.
Yeah. Well, thank you for listening. I'm sorry it was only me talking.
Well, a lot of people were talking through you, Wendy.
Yeah.
No, I just want to say about this last poem, "We Are Made from Stars." I love this stanza. Not shining brightly from the universe, it rests its final destination. And that really, that just sort of hit home, because we'll all have a final destination, and yet you embodied both something living in this piece of rock, and yet, you know, a marker of a final destination.
Thank you, but that I think because Roger, who was the sculptor for that, I mean, he put his heart and soul into this piece of stone, and you can see that. And it was, I mean, it was incongruous. It was funny because these men in their shorts, it was one of the hottest days, bringing this huge star, sort of just, and it was wrapped in bandages to protect it. So when they undid the bandages, and the men were sort of like that, worn out, and everybody was going, because it is just wonderful. Yeah, it's its final destination. Mm.
Something else I want to say about the book, I had read it before, but read it again anticipating your reading tonight. And, you know, the ways in which you depict cancer in the beginning, I found myself getting more and more frightened, you know, because I guess we all want to hold these things at bay, and you know, it's quite frightening. But even that opening, Cancer's daily walk. Cancer will walk in the country, in fields. Cancer will walk in the town, in the city. It's like, where is it walking?
Yes. Sorry, I didn't mean to do that.
No. But I think I only say that for the power of this, and that, you know, in a way, when we are dealing with significant illness, we both need to be at home with it and never at home with it, right?
Yes.
And so
yes.
one has to traverse something of that resistance each and every time.
Yes. Yeah.
Right?
Yeah. Yeah. It's this thin line that we walk all the time between, well, mental health, illness, life, death, whatever. I think crossing the road, anything. Yes, I suppose because when I wrote the book, I was trying to sort of come to terms with all that I'd seen at the centre, because I hadn't left my work with at the hospital with any intention of doing any more healthcare work. I was going to do something. I didn't know what I was going to do. And then I sort of fell into this, and it has grown since then. So everybody that I work with, I'm trying to come to terms with what's going on for them, whether it's aphasia, whether it's adults with a mental illness, or children who have been abused, or whatever I'm doing. I've just done some work with victims of domestic abuse. Whatever I'm doing, I'm trying to come to terms with how it started, what's going on, how we can cope with it if it happens to us. I think that's what the book was about, really.
Right.
I think.
Yeah. Well, thank you so much, and
thank you for listening.
You're gonna pick up right, I know, right where Wendy left off, particularly what I think we'll see resonating through your work, Dan, what you began saying, Wendy, is that everyone is a story.
Yeah.
And Dan is a poet, but through his poetry, a real storyteller. His poems remind me a little bit of William Carlos Williams has a book called The Doctor Stories. That's prose, of course, but the storytelling is a very, very strong element in Dan's poetry that we look forward to hearing. And Dan, look forward to hearing from you how you grapple with these same images or the same issues that that Wendy's highlighted. And I don't know, do you want to give us a preview? Is there anything you'd like to say about what's in store for us next week?
Well, I mean, I don't think I've ever written a poem that didn't have a speaker in it who started at point A and ended up at point B. So there's somebody moving through time and space, and there is a story happening. And you know, something that's come up often in this series is, whose story is it? You know, what right do I have to appropriate this story? And so, you know, one of my teachers told me it's okay to lie, and you know, to sort of make it up. You know, do what you need to do to make it more interesting. I try to stay interesting and approach serious subjects in sometimes a lighthearted way, self-defense.
Well, those lies so often get at a deeper truth. You know, I mean, truth in that way is what we're kind of allowed to say, but when we enter the realm of making it up, one can call it a lie, or one can call it the launch of intuition. And you know, if one were to say more, where would that take us, right? And so
Yeah.
we look forward to hearing you next week.
Thank you.
Well, Wendy, thank you very much for chatting with us and for reading for us.
Right.
Owen, again, thank you for all you do to bring poetry to us. And Dan, looking forward to your reading next week. You can see a recording of this evening's performance on the Stockbridge Library's YouTube channel. So if no one has further questions or comments, I wish you all a lovely evening.
Thank you very much
Thank
for
you all.
having me. Thank you very much.